some talk about pain management and some treatment options. And so many people suffer from this. It's going to be a really good segment. So if you would give these guys your attention, please, for just, I think they're going to talk for about 15, 20 minutes, is that right? So, anyway, if you can, come over and sit down in these chairs we've got here, and we're going to turn it over to Dr. Ali.
Very good. Thank you. I appreciate that cheer. Somebody had their coffee this morning. So my name is Danish Ali. I am a pain management specialist here at Dynamic Pain and Wellness. I was asked to talk about harmful side effects of opioids, and we'll definitely get there and we'll talk about that. But before I do that, I wanted to introduce myself first, give you a little bit of biography, a little bit of history as to where I come from and my experience with opioids and specifically in pain management. And then we've also got Dr. Gabriel here as well. He's a chiropractor. He'll be talking about some of the conservative options and some other things that we can do to help folks that are in chronic pain. So a little bit about myself. Like I said, I am a pain doctor. I originally from Texas. Anybody from Texas? No. All right, exes live in Texas, yeah. And so yeah, originally from Texas. I went to undergrad, medical school in Dallas, residency in Brain Spot in Austin, and then I did a pain management fellowship at MD Anderson and UTMB in Houston, Texas. And after that, I came here, and I've been here for almost 2 years now. One of my major goals is to help folks that are in chronic pain. People don't understand that there's so many different options that exist for folks that have chronic pain. And that's where pain management specialists come into play, and they talk about other interventions, other medications, other things that we can do that can help reduce people's pain and burden on medications, specifically opioids. So I do want to shed some light on opioids themselves first. I want to talk about what they are, how they came about, and how we led to this opioid crisis that we're in right now, right? So opioids are medications that attach to the actual morphine receptors. We have receptors all over our body, right? So anybody that has any sort of pain, whether it be they fell, they were in an accident, they have some sort of arthritis that they've developed over the years, there's upregulation of those pain receptors, and that's what gives you that perceived notion of pain. Opioids attach to those receptors, and what they'll do is they'll bind to those receptors and they'll produce pain relief. And in theory, that sounds great. In the 1980s and 1990s, there was a big push for pain medications. Everybody that had any sort of pain got opioids. And so that led us to where we are now, because we ended up discovering that there was a lot more to these pain medications than we initially thought. And just in 2017, we had over 48,000 people that died while taking opioids. And that's an astonishing amount of people that were that died. And so, how does that work, and how kind of what causes them to happen? It's basically folks that end up taking medication that's prescribed. However, sometimes as we age, we get other comorbidities like COPD, asthma, respiratory issues, cardiac issues, and things that used to work, the heart, the lungs, they don't work as well as they do. And there's this magic threshold that you hit, and that magic threshold is where folks that experience those side effects and ultimately death as well end up leading to that. So there is some of the side effects I want to talk about as well, just quickly, and then we'll kind of dive into the meat of the topic, which is back pain, neck pain, kind of what to do about it. I'll talk about that, but these medications are very bad medications, and that's why a lot of times my goal is to educate folks on the side effects of these medications, how they're not meant to be taken for a long period of time. They have so many issues. There's so much stuff out there that causes harm to folks. And the way that I like to explain it to folks is basically, our bodies are constantly in a hemostasis, right? We're all constantly at a specific level, at a specific area. And folks that end up taking pain medications, that hemostasis, that normal is different for them, right? And so, because of that, over time, they build a tolerance to those medications, and so they have to take more in order to maintain their normal, their hemostasis. And that happens because these opioids have that euphoric effect, right? They make you feel good, they make you feel normal, they make you feel like you don't have pain. So over time, you end up taking more of those medications, and that's what leads to ultimately death, right? Other side effects do include nausea, vomiting, constipation is a big one, that even being on opioids forever, you will still have constipation. Other things you build a tolerance to, and the main thing is that the respiratory depression that you end up getting as well with opioids, and ultimately dying. You and I, folks that don't take opioids, at night when we sleep, we have times where we go apneic, we don't breathe, but our bodies adjust. They respond to that. They, make some sort of adjustment, take a deep breath in, But folks that take opioids don't have that response. And so what happens is that those are the same folks that end up passing away in their sleep as well. So, we've heard those stories about, he went to sleep or she went to sleep totally fine and did not wake up the next morning. It's because of that effect. There are alternatives, and that's where my job as a pain management specialist comes in, to discuss these things with my patients and to make them aware that there are other things that we can do for them. All of us will get arthritis. We will get some sort of arthritis, some form of arthritis as we age. Nobody has come up with a solution exactly yet. If we do, we will be gazillionaires because, there's just no solution to it. Once you develop it, which you will as you age, and folks have everybody has a different perception of pain, right? Pain is a sensory, emotional response. And so a lot of folks have different ways of how we deal with pain. Unfortunately, in America, we are like the #1 prescribers for opioids and narcotics. 99% of our hydrocodone, one of the common opioids narcotics, is given and distributed in the USA. And so it's a big problem, right? And so that's why I talk about some of these other things. Physical therapy is great. There are lots of folks that benefit from exercises, from stabilization of their core muscles. People don't understand that our cores actually attach to our back. So if we can stabilize and strengthen our core muscles, that'll help reduce a lot of back pain, number one. We have such bad habits for our neck as well. We are always constantly keeping our neck extended. We're on our phones. That is the worst posture for our necks. We need to keep them extended, neck extended, shoulder back. It's that military position that people know about, right? Shoulders back, neck back, and not leaning on your phones and stuff are very important. There are other medications out there as well. There's NSAIDs, anti-inflammatories. These are actually one of the most helpful medications because they help decrease the pain that's coming from the arthritis. And so there's that. There's muscle spasms medications. People often get muscle spasms because their muscles are not functioning like they should. They're not using the muscles that they should. And so that's where muscle relaxers come into place as well. And then oftentimes with arthritis, it irritates the nerves. Therefore, nerve pain medications like gabapentin, Lyrica, those sorts of neuropathic agents that decrease nerve pain are very helpful. So people think that, if you have pain, you gotta go to an opioid, you gotta go to a narcotic, hydrocodone, Lortabs, Percocets, etc. There are so many other medications. The majority of what I do being an interventional pain doctor is do a lot of interventions I do a lot of injections for folks that have developed this arthritis. And again, it's not to get rid of the arthritis, it's to decrease the pain that's coming from that arthritis. And so we do a lot of nerve blocks. We do epidural injections to help folks with the nerve pain. And then we also target some of the arthritic pain as well by doing facet injections or targeting specific areas. And that usually comes in with doing further imaging testing, getting an evaluation by a pain management specialist to kind of see what's going on in that standpoint. There's also been lots of research and studies that have been done that have shown effectiveness on other things beyond just some of the stuff that I talked about, and that is yoga has been shown very effective. Tai Chi is another form of yoga that has also been shown. And then there's also some of the chiropractic work as well that has been shown to be helpful. And so there are other options out there, and that was my, kind of my thought process to discuss with you all was to say, hey, listen, there are other things that we can do. If you are in pain, seek attention from a pain management specialist. Talk to your primary care doctor first. Get a referral. They're the gatekeepers. They'll help determine where you need to go first. And at all costs, avoid surgery, because surgeries, there's a lot of complications. And what I tell folks, there's two very common reasons why I would refer to my surgery colleagues, and I have. One is if you're actually having objective weakness. A lot of people feel weak and have pain, but actual weakness that, hey, I cannot grip my coffee cup, or hey, I can't lift, or hey, I cannot lift my leg up. Those sorts of things are things that the nerves may not be communicating like they should, and that's why it's very important to seek surgical consultation for that. Or bowel or bladder incontinence, meaning you're urinating on yourself or having a bowel movement and not even recognizing it. Those are some of these neurological emergencies that need to be addressed sooner than later. As people get arthritis, it gets at multiple levels. Those surgeries are very in-depth and lots of times, and I think I'm biased to that. As a pain management doctor, I see a lot of, complications or issues from folks that have had surgeries, and so they're coming to my office, telling me, hey, I've got all this surgery, this has happened, and that's happened, and so there are the right candidates, there are right folks for it, and you have to be very cautious as well on that. So, having said that, I do want my colleague to come up as well and talk a little bit about what he does, what he can offer folks with chronic pain, whether it be related to nerve injury or arthritis as well. And so, without further ado.
So, that was really awesome. You're clearly very, very knowledgeable about all of that, the pain aspect of everything, which is fantastic, because we need more people. We need more people that understand that there are other options. And so, as a chiropractor, we are another one of the options. We're a little bit different than most of the other chiropractors that you think of in how we deal with pain. So this may be even a little bit different from what you know, but I would probably say that most of your patients come in post like traumatic events, post-car accidents, stuff like that. Would that be accurate? Okay. Yeah, and so that's pretty common when we have those types of injuries, like whiplash type injuries, seatbelt injuries, trauma to the structures of the body. We get pain. And if you think about what pain really is, right, it's our body's way of telling us that there's something not right? At a very basic level, something's not doing what it's supposed to, and it's telling you to stop. And typically, well, it only hurts when I bend over. It's because when you're bending over, you're causing more damage, right? So, and I'm not going to talk very long about this, but our focus and our view on how to deal with pain is taking care of the nervous system and the structure, just like you were talking about. Because if you think about what the nervous system does in the whole body, it relays the pain signals, right? But the nervous system also controls absolutely everything else in your body, right? Without your brain, you're not alive, right? And it sends all those signals primarily through the spinal cord, right? Spinal cord is protected by spine, neck pain and back pain. So the joints start to degenerate, creates arthritis, right? And now you've got these complicated factors that he was talking about. And so when we're looking at your body and the symptoms that you come in with, we always go, well, why is that there, right? And so the biggest part of understanding where you're at, where you should be, and who's going to help you the most is to understand why that problem is there. You probably have people that there's so much change and stuff going on in their body that they may never be able to completely resolve their issue. Would you say that's accurate?
Yeah.
Sure. They're always going to have pain. We have that too. We see people that they're always going to have a little bit of pain because their body is stuck. But our goal is to find where people sit based on their structure, their nervous system, how things are functioning in their body, how the muscles are moving, how the joints move, all of that stuff. Figure out where we can help that and improve that system so that way the brain has better communication and functions better around those areas. Better function is going to allow those muscles to work better. Just like he was talking about with yoga and physical therapy, changing the core structure of the body, the nervous system is in control of all of that. So we want to make sure that that system is cleared, so that way when you have your physical therapy, or you get those injections, or when you have to take that medication, that it's more effective, because all of those other little factors aren't playing into your pain. So the fact that your neck isn't moving isn't the factor that your low back is causing you excruciating pain. And so you don't know that until you evaluate until you look. I see a lot of people in our office that come in with chronic low back pain, and the problem is not in their low back. The problem is in their neck. And they've had a car accident, and their structure and the function of their low back is phenomenal, but they have pain there. But because of the change and the change in the structure, just like with the head being forward and all these funny positions, that it's changing the way the functionality and the pain receptors and all of those things are working beyond that, down lower in the body and away from the brain. And so, as an upper cervical chiropractor, my goal is to clear out the brainstem and allow your nervous system to function at its highest level, so that way, when we go in and make those changes, your body can understand what's supposed to be happening, orient itself in space, and move the way it needs to, so that way you're not experiencing that high level of pain and dysfunction. I don't know if there's anything else that you want to add, but I think the important thing is, and he said this too, is that the opioids are not necessarily the best route. And obviously there are people that absolutely need it. But it's not a long-term fix, right? The opioids, the opioids don't fix anything. And so you have to do the other stuff, you have to do the work, and you have to take care of your body, so that way you can get off of it, right? And move forward through your traumas, through the dysfunction, and allowing your body to be healthy again. Because a healthy body should not be in chronic pain. Make sense? I really appreciate you guys allowing us to come here and talk to you, and hopefully we can get you guys some more information. I'll be around for a little bit. We'll be around all day. My team is over there. Talk to them. They're very knowledgeable and help you out as well. So again, we really thank you. We really hope we're able to serve you and hope you get the information that you need.
If y'all have any questions, I'd like to do a little Q&A as well, and shed some light. It can be on anything. Tina's got her hand up right there. I know Tina's got a lot to say, and hopefully she's got a question in it as well.
Tell them what happens when you take too much opiates and your pain is really bad.
Yeah. So you could die, right? Yeah. Yeah, beyond that, I mean, so yeah, as I was talking about, you have that normal hemostasis, kind of normal, what you define, your body defines as normal, and once you start taking pain medications, your new normal is that pain medication, right? You build a tolerance to that, and then you end up taking more and more of it. That's when you get those side effects that we talked about, and ultimately, there is a magic threshold you hit, and it can cause you to die. So your normal hemostasis, that is what's abnormal, and you end up taking more and more of it because you build a tolerance to it, and once you've got that tolerance, that's when you develop more and more symptoms to it, or side effects of that. Yes, please.
Dr. Gabriel.
So you're from a former Marine, right?
I am.
Okay, do you do little classes, seminars, smaller studies for military spouses? Is that what we just talked about?
I can.
Okay, so I have an organization I think could use their help, so I'd love to.
I know you just talked about Marines, and I thank you for all your service and your spouses. There is a big component of post-traumatic stress disorder, PTSD. There are studies that have come out and have shown that there are some interventions that we can do that can help with folks that are suffering from that. There was a special on 60 Minutes that happened I think 2 years ago, maybe a year and a half ago. They talked about some of these interventions that we can do to help folks that are in that. And I've had some patients and referrals that have come into my office and they've received some of these interventions and that's helped their PTSD. And I have a patient who was on the verge of committing suicide and we were able to help him. So there are other options out there, especially if you suffer from PTSD. Yes, ma'am. That's the hardest job of what we do, right? We're so used to handing out medications, and that's the hardest part is that emotional component, right? That's exactly right. Yeah, and so that's why it's important to have a specialist that these folks are examined by, have somebody that has looked at their imaging studies, because again, like you're saying, if you're not getting to the root of the problem, we're never going to be able to solve it. And so that's the dilemma that led us to where we're at now is we were just masking it with giving narcotics and these bad medications and things. We weren't getting to the source of it. And so that's why folks like yourself, being massage therapists and chiropractor, those are so helpful for what we do because we're not underlying and addressing the basics of what's going on, and we're not going to be able to help with pain. So I thank you guys for what you do. Thank you.